woman, Maria too. I got to know Maria through the DCCC, Dallas Chinese Community Center. We used to sit on the board together until she was elected councilwoman in Plano in spring of 2019. When I first met Maria, she struck me as very different from my other Asian colleagues at DCCC. Her sharp, no nonsense, and to the point talking style is very different from your stereotypical shy and compromising Asian Americans. Her personality and the way she conducts herself has made her a perfect city councilwoman, I think, and perhaps even something bigger at the political arena in the future. So she can be an active advocate for the Asian Americans and Pacific Islanders. Maria came to America at age 9. She'll tell more of her story. I just gave a few sentences. After college, law school, passing bar exam at the Washington State, Maria was hired by one of the top 6 Washington law firms to deal with international business transactions between US and Asian companies. After moving to Texas, Maria again passed the Texas bar exam and was hired as a prosecutor for the Collin County DA's office. She successfully prosecuted criminals and helped make our community safe. She owns her own law practice now, and she was recently awarded the Top Achievers Heart of a Servant Award for 2019. Maria is accompanied by Miss Rainey Lane to assist in responding to questions about nonprofit funding and grant applications. Rainey, can you raise your hand? Rainey is the City Cultural Arts Grants Administrator and also the Cultural Affairs Commission staff liaison. While their talk will focus on Plano, Texas, or Texas in general, is just one example of how local officials and governments interact with their citizens and constituents, and why it is so important for government officials to reflect the communities they serve. Okay, without further delay, let us welcome both of them. You can give us thumbs up, meaning that you acknowledge.
All right, I'm going to start with a share screen, and it's a very short PowerPoint. My name is Maria Tu. This pretty much sums up who I am as a person. I'm a wife first, I'm a mother second, I'm a lawyer third, and I'm a Plano City Council person last. Now, as Lisa said, and thank you, Lisa, for that wonderful introduction. I really appreciate it. And I really thank all of you for inviting me to this very, very important presentation and learning about the effect of health in the Asian community specifically. So I'm married to Gary Tu. We've been married since 1993, and we have a daughter named Vivian Tu. So after coming to Texas, I actually did not go back into the law practice for a very long time. During that period of time between the time when when I came to Plano, Texas, and the time that I actually took the law license in 2004 in Texas, Gary and I actually started a sushi wholesale business where we deliver sushi to grocery stores in the DFW area. So that was a brand new enterprise in Texas. It's not in Washington State, but it is in Texas. So we did that all the way up until 2004 when finally, you know, we got exhausted and Gary was retiring at that time, and it was time for me to change my course of action. So that was a little bit a little tidbit about myself. Now, back in around 2018, I decided it was another time for me to start looking at different ways of, you know, presenting myself and helping the community. I've done a lot of different things. I never ran for an office ever in my entire life. And so I decided that in 2018, with my daughter graduating from college with a job, and my husband being retired, that it's probably time for me to look at something new for me to apply myself. So back in 2018, I decided to run for Plano City Council, unbeknownst to me, that it was the most contentious race ever in the city's history. But it was a very, very good experience. And on May 4th, 2019, I was the first Asian woman in City of Plano, first Asian, first Chinese, first Asian woman who's ever been elected in the City of Plano Council in an elected position in the Collin County area. So I'm very grateful for the opportunity to do so. But the trip and the journey of getting there was rather interesting, because I made the announcement at the time of November 2018 to run. And right after I made the announcement and my signs were being made, you know, vote for Maria too, my husband went into emergency. And on December 31st, 2018, while my signs were going up all over the city, this was what happened in the hospital. So that's my daughter right next to her, and right next to him. All right, so that's the end of my PowerPoint. I'd like to get back to the regular screen. All right, so I tell you this because I think my elected position and my husband's journey through his cancer treatment is so intertwined. For some reason, I believe it is, there's a reason why all this is happening. So at the end of December 2018, when my husband was first diagnosed with pancreatitis, and a CT scan was done, when the doctor says that he believes that there may be a possibility that it is not just pancreatitis, but it is pancreatic cancer. Well, my daughter and I have no idea what pancreatic cancer is. We didn't even know what pancreatitis is. So all we can see was the doctor's face, very solemn and very serious, and that sort of triggered my understanding that maybe this is very serious. So Gary too went into the hospital in Baylor. And so during the time while he was in the hospital, and we were there for nearly a month while the campaign's going on, and we were staying there 24 hours a day. All of us were Googling on the internet, trying to figure out what exactly what is pancreatic cancer. Gary could not get a surgery at that time or to have any type of further CT scan to figure out what can be done to him, because his pancreatitis was so severe that it blocked all the images from the CT scan. So the only thing that we can do was wait. And we had to wait until the pancreatitis actually reduced in inflammation to the point where another CT scan could be done to see whether or not there is pancreatic cancer present. So for the next 10 days, all we did was every day we would ask the nurse, so what is the number for the pancreatitis? You know, is it now lower or is it higher? And so we were counting the number of how the inflammation digits were going until we got to the point where, you know, it was safe for him to get another CT scan. So about 10 days later, the doctor took him in and did another pancreatic CT scan to determine whether or not he has cancer. And that was when we found out that they believe that it is a stage 4 pancreatic cancer. So what does that mean? No idea what that means. My daughter and I were just looking at the doctor, trying to figure out, you know, what do we need to do? Is there anything that we can do? How do we get more information? How do we help them? How do we treat it? Well, here's the problem. I believe that with any cancer patient and their family, the journey itself is already very, very difficult. But for somebody who is like my husband, whose English is not his first language, he doesn't understand a lot of the English language. The journey is even more difficult because that means one of us, my daughter and I, have to be at the hospital at all times, because anytime when the doctor walks in or a nurse walks in, we have to be able to ask the questions and then translate the answers to my husband. Obviously, in the hospital we were at, there were no people who speak Chinese. We had no Chinese nurses that were around in that area. And so we had to first learn and then tell Gary and then translate for Gary. And we had to actually grasp the knowledge, not just understanding the words, but grasp the knowledge and then be able to convey that to my husband. And, you know, we had a little family meeting where we talked about, you know, how much should we share with Gary, because, you know, obviously stage 4 means he's dying. And, you know, we ultimately decided that it is not good in our family to hold secrets because we just don't know how, and I'm a really terrible liar. So we just decided that everything that we learn, we need to share with him. While this is going on, my campaign was also going on. And I just, you know, Gary and I talked about this, and I told him, I said, Gary, you know, with you, you know, trying to survive a stage 4 pancreatic cancer, maybe this is not the right time for me to go forward on my campaign. And, you know, he turned around immediately and said, don't you dare give up, because that's what we do as human beings. We move on, we just keep going. We do not say, you know, we give up, or that we declare that we are, you know, we're losers when we are, you know, when we're moving forward in life. So I said, so you're telling me that I need to keep going on my campaign? He says, absolutely. And he says, if you don't, you know, even if in my grave, I will come back and haunt you. So I said, okay, fine. So that was what decided that I was going to continue my campaign. But during that first period of end of December and during the entire month of January, we were in the hospital every day, and then I would go to campaign, then I would go to work, and then I would come back to the hospital. That was the most difficult part. Was my daughter had very difficult time understanding the medical terms, and so I was making a lot of inquisitive asking questions. Obviously, I'm a lawyer, so I cross-examine every doctor that walks into the room, and they hated me. So they would choose times when I'm not there. So for example, they know that I would leave at 9 o'clock. So they would come in at 10, and they know that my daughter's there, and my daughter wasn't gonna ask them any questions. So they would come in at 10 o'clock, walk in, check in with my husband, and then they leave. And so when I come back, you know, at 4 o'clock or 5 o'clock in the afternoon, I ask my daughter, well, what did the doctor say? And she'll say, well, I don't know what they said. All right. So that was another part of the that was the story that, you know, I absolutely hated. Well, then the next question is, now the pancreatitis is over and we decided it's pancreatic cancer. So do we have a surgery? What's the treatment plan? What do we, you know, where do we go from there? Well, it was decided at one of the I guess, examination that Gary's intestines were 100% blocked. So in other words, he cannot swallow any food on his own. So the doctor says a surgery is absolutely required. Regardless of whether or not we're going to be able to do a Whipple surgery, we have to do an intestine bypass so that he could at least eat. So I said, well, that's great, because if you are going to do a surgery, then maybe Whipple is a possibility. And first, I'm sure all of you know what a Whipple is. I'm the only one who had to learn. Basically, that is a surgery where where the pancreatic cancer patient has a lot of the tumor removed so that they can, you know, and possibly some of the infected organs removed, so that there's a possibility of having cancer-free. As you know, that's a possibility. And Whipple surgery is only limited to those people who are qualified, and it's a very, very small percentage of people. And they take away, you know, a lot of your organs, but ultimately the end goal is so that you don't have any cancers in your body anymore. So Whipple surgery is a hope for most of the pancreatic cancer patients if, you know, if you're eligible. Well, we don't know if Gary was eligible because, you know, the CT scan wasn't showing enough for the doctor to make a decision. But it did have, but the surgeon did say that a bypass surgery for the intestine was absolutely necessary. So while he's going in there, he's going to see whether or not Whipple is a possibility. Fine. Then the doctor says, well, he may not make it out from this surgery. Oh my God. So as soon as I heard, I immediately got my lawyer friends to come over and do wills, power of attorney. And then in one evening, I had the notary come, the lawyer come to do a living will, a will and testament. We had notaries. We had everything done that evening before his surgery, because we just didn't know what was going to happen next. And all that I was doing just automatically. There was no emotions from me. Everything was all going through a different brain. And my daughter, poor Vivian, she had it. She just says, Mom, I need to just get out of here. I can't deal with this. And I, you know, I basically nodded, you know, in basically in numbness, and said, that's fine. So Gary did go through a surgery, and he did the bypass. The bypass surgery was successful. But then the doctor came back and says, well, a Whipple surgery is not possible because the cancer has spread, and he is officially a stage 4 pancreatic cancer patient. And I said, well, what's his prognosis? I mean, are we looking at 1 month, 6 months? I mean, what are we looking at? And he says, well, you know, based on all your research that you've done, Maria, you should probably be better to telling me his prognosis than I could. I said, okay, well, what I've read on the internet doesn't look very good. And he says, yeah, that's actually the truth. So, you know, Gary and I also talked about this, and Gary was very optimistic. He says, look, you know, we're just going to take one step at a time. We have no regrets. So let's just move forward. All right. So here comes the challenges. After the surgery, after everything's done, now what? When he goes home, what counseling can we use? What transportation can we use? If there's anything that we need to arrange, we have to have somebody who speaks Chinese, and there is just none. So we really had to rely on friends who were able to bring food, offer transportation for him to go to appointments, wheel him around so that he can go to different places, because there is just not a lot of, there's not enough support for people who don't speak English. And other than me and Vivian, there really is nobody that, you know, that we could really go, you know, to really ask for help. And so I haven't been the best wife ever, because every time when I go to the hospital with the doctor, I end up yelling at the doctor. So they don't really like talking to me. And I always tell myself, I'm not yelling, I'm just asking, I guess I'm interrogating, but you know, I want answers. But the only doctor that we finally found after changing our doctors many times was somebody at the Southwestern Medical Center, and he's been very patient with me. He would answer all my questions over and over and over again until I'm happy. And I think that really helped with our, you know, our continued journey through this. Now, so Gary did go back to the hospital about just beginning of July of this year, and he had a pain in his stomach. And again, I had a really loud argument, I guess, or discussion with the doctor that was there, who told me basically that that Gary is dying. And I refused to accept that. I told him he has an inflammation in his stomach, but it's not a dying inflammation, and you need to treat him. I literally had to fire that doctor to get another doctor to come in order for that doctor to say, yep, it's an inflammation, and we're going to treat it with a very strong antibiotic. So that was how that went. And you know, Gary ended up staying in the hospital for another week, in which in this time we're blessed because we had a Chinese nurse who speaks Chinese. And so she saved my life, because when she would be on shift, I could go home and take a shower, and then and I could go home and eat or relax or change my clothes, and then come back, and then she would report to me, you know, what's going on, and she's able to communicate with Gary. That was such a blessing for me. So that's the journey that I have been going through with my husband. Now, why is my political life intrinsic with Gary's cancer journey? Well, as I've told you already, my campaign started when Gary got his cancer. Well, since then, you know, we've been in this pandemic. So not more than 6 months after I was elected, we started having, you know, stories coming out of different areas of not only within our country, but outside of our country, about all these horrific things that are going on with the virus spreading. Now, what is the first thing we do in our family? I immediately told Gary, you need to stay home. He says, I am already staying home. I said, yeah, but you need to stay home more. He says, well, you need to go and tell your community that they need to stay home, and not me, because I'm already home. And so the next thing, I believe the Chinese community is much more advanced than rest of our other community in starting to wear face masks and starting to have gloves and sanitizing everything. Gary, my husband, was very happy about this, because he says, look, now everybody is staying home with me. So I'm not the only one now being left out of all the things that are going on outside the house. I say, yeah, but you know, you shouldn't be happy about all those things. He says, yeah, but you know, that's just him getting more positive. So while the face mask was going on, in the debate is going on, I don't know if any of you know about Plano, Texas, but Collin County has the largest population of very conservative groups, politicians. And this face mask thing became a political discussion rather than a health discussion. And whenever we try to even bring up face masks or stay at home as a ordinance, it became a fight in the city council between the different political groups. It got to the point where when there is a proposal to have face masks mandated in all the businesses, it was, I mean, the discussion, the city council meeting lasted, I believe it was 4 hours, just on the face mask, whether or not to mandate the face mask. 4 hours. And the only reasons why is because it became so politically entwined with, you know, I guess the positions and you know, the election coming up in November. So ultimately, City Council in Plano did not pass a face mask mandate. Instead, after it did not pass because we were the minority, the governor of Texas, 2 days later, mandated that everybody wears face masks. So I felt like I was vindicated, but obviously it was a total nightmare trying to do that in government. All right, so the Collin County and Plano, the virus is still spreading and it's increasing. It has not died down. It is still going very strong. So are we still, and yet we also understand homeless people are becoming more and more prevalent. There are more people who are out of job. There's more people who are food insecure. So between the two, the city council right now is trying to find a balance where all this could happen, you know, where we could help people while keeping everybody safe. So at this point on the city council, every time when I have to take a vote or if I'm considering something, the first thing I think about is, how does that affect my family? How does that affect my husband who is cancer stricken? How does that affect the people who are in my neighbors? And those are my core values that I use to continue in my battle in the political realm. So Lisa says that she wants me to see me in a future political regime, but I'm telling Lisa, no, I think I have enough. I kind of like city council. This is good enough. It's, you know, it's home, it's close to home, but I think that's all I really have. Rainey is the city staff. She has a lot more knowledge about what are some of the programs that are available. You know, a city council, we basically are board of directors, and we just come in and say, oh, what's your recommendation? Oh, okay, that sounds good. So that's how we go about moving forward. And I hope that my story helps to encourage people to continue to look for solutions and how to help you know, the populations who are, you know, non-speaking, English non-speaking, and hopefully we'll be able to find a cure. And that was one thing that that I put on my Facebook was, there is this Operation Warp Speed to find a cure for the coronavirus. Well, how come there's no Operation Warp Speed to find cures for cancer or for any, you know, MS or anything else that has been in our society for so long? So anyway, that's it. That's all I have.
Yes, that would be great. Let me share screen really quick.
I realize that we have people from all across the country, but for the folks that live up in Plano, this will be good for you.
All right, can you see my screen?
Yeah.
Wonderful. Okay, so my name is Rainey Lane. I actually have been in the budget department with the city of Plano for 6 years. And I have managed the the Convention and Tourism Fund And I have worked with the grant funds, which is HUD monies. I have an overall understanding of all of the grants that the city of Plano offers to its residents and to local nonprofits. So I was just asked to kind of put together a little kind of a cheat sheet on what are all the grants that our city gives to nonprofits. I've also listed some that are open to businesses. So we do have 3 departments: neighborhood services, planning, and budget and research, that manage these grants. So the largest number of grants is neighborhood services. This is probably the one area that pertains the most to this conference. Neighborhood services has the Buffington Community Services Grants. And this grant provides funding to nonprofits to advocate, provide counseling for mental health or rape crisis, or just kind of making sure our residents are getting what they need when they need during times of distress. In addition, they have our HUD and our home grants, and these benefit our lower income constituents. So these are 2 of the major grants that might be most applicable to this conference. However, we do also offer neighborhood vitality and beautification grants. When an older neighborhood becomes less desirable or in distress, we do offer grants to the neighborhoods that want to work on projects in their neighborhood.
Rainey, let me stop you because we're running out of time here. I think I saw a few hands. People had some questions for Maria.
You bet. But just the other grants are cultural, arts and events, and historic.
Okay, and you're going to share that with everybody, right? So
I will email this document to you.
Right.
It has hyperlinks and contact information.
Terrific, thank you.
You're
So anybody have any questions? I thought I saw a few hands here. Maria, how's your husband doing now?
He is at home. He's getting weaker. In all honesty, after the second hospital stay that we had in the beginning of July, he literally sleeps 10 hours to
Sure.
16 hours a day. His chemo treatment is every 4 weeks, and that was because he negotiated with his doctor. The original treatment was supposed to be every week, and he says every week is too much, so he negotiated for every 2 weeks. Then he said every 2 weeks was too much, so he negotiated every 3 weeks. And then not only was he negotiating every 3 weeks, he wanted the dosage of the chemo treatment to be reduced. So he finally had to sign a, what is that called, a death warrant, basically saying, look, I don't care if I die, just don't make my life miserable.
Yeah.
So the doctor made it into every 4 weeks. So now he's on chemo treatment for every 4 weeks, and it will
He's
continue
opting
until,
for quality of life as opposed to,
right. It will continue until he dies.
okay. Did anybody have any questions?
I have a question. You know, through your own experience, Maria, and also in the city of Plano with Rainey, this is also for you. Is there any sort of infrastructure or a resource where people can go to if they're really seeking for help? And also, Maria, as a councilwoman, what would you do? I know that you went through a lot with Gary, but in order to make other people's life easier, what would you do to improve the, I don't know, the logistics perhaps to help others?
Yeah, I think that's one of the things that has come up in City Council. And one of them, because diversity really does help in promoting brainstorming and different ideas. And one of the things that I've noticed was, you know, a lot of the information that City of Plano puts up is absolutely wonderful. They have a lot of resources, but what if you don't read English?
Yeah.
And what if, you know, you don't read? So, you know, one of the things that I have tried to promote is putting on the language, they have like these Google language button that you can push to make it into a different language. We're still working on, you know, making it so that people who cannot read or who's blind, you know, able to be accessible to the information that's out there. But I think Plano is really in the front line in trying to make these adjustments and changes. But you know, it really does help to have different diversity of people from different backgrounds looking at, you know, what's being offered, because there is a lot of resources. You know, Rainey's little cheat sheet doesn't even begin to tell you how much resources Plano offers. And I'm sure a lot of city and in your community also offers that you just don't know because you haven't been able to absorb it all, or you're not able to access it. So.
Okay, well, we're kind of running out of time here. May we ask if anyone has any questions? Can we email them to you?
Can I have a quick question?
Sure,
Yeah.
sure. Go ahead.
Yeah. Yeah, Maria. Yeah, I think I just heard your story is very powerful. I have a question. Okay, I know as a woman. Okay, I know you say your first priority is as mother and wife, whatever. But I would just ask you, as a woman, as an Asian, okay, in Texas, okay, in Texas, very conservative politics. What you know? I'm sure you probably face lots of. I don't want to say blatant discrimination or racism, you know, racist remarks. How can you overcome those challenges? What advice you can offer us, you know? Because like you just say, at the city, they probably have lots of resources. How can we, like Alliance in Houston, how can we break the cycle, the glass ceiling to make our voice known to them?
Yeah, I think you hit something that's really sensitive, and I believe that the way that I have been trying to overcome challenges such as racial injustice or racial insensitivity is to prove them wrong and to continue to insist on the things that I believe are my core values. So for example, if people don't understand that Chinese New Year is very important to me, then I make them understand. I do a story in every email, every Facebook, and I keep telling them. And if they make a joke about a certain racially insensitive things, I tell them. I go up to them and say, I think that's really racially insensitive, and I tell you why. I think by confronting people, I don't believe everybody have a, you know, they come from a space where they want to be racially biased. I believe that they're just ignorant. A lot of time they're ignorant. And we need to stand up. And we have to use our language, regardless of whether or not we have an accent. And I tell my husband that all the time. I don't care if you have an accent and people don't understand you, speak up. And you need to continue to speak up until people understand what you're saying. And that's how, you know, by being on the elected council, I'm starting to see a lot of Asians starting to come to meetings, participating in committees. And, great. You know, and I think those are the things that we need to do. We need to stop being scared and really just start to speak up. And you know, conferences like this is perfect because it gives us the tools. So when we go back, we are speaking up with knowledge. We're speaking up with support.
This could be a whole conference just on this topic right here.
Right.
But we thank you very much.
Thank you.
we want, before you leave, and you're certainly welcome to stay with us as long as you can, we want to take a group photo, which basically on Zoom means Ellen's going to do some screenshots so that we can capture everybody. So some people don't have their videos on, so can you turn them on, and Ellen will tell you when to smile and when she's going to shoot your photo. So make sure that you can see your entire face in your screen, because some people I can see the top of your heads, or so make sure. Like Kai, I can see your hat, but so can you? Yeah, you have to sit up more. Yeah, there we go. Okay.
Okay, let me see. For Nancy, I cannot see your face because the light is behind you. Maybe you change the way. Nancy from BPSOS is still dark, but if you don't mind, okay. Let me see. Okay, so we have 3 have not turned on their video. Okay, that's fine. Okay, get ready. I will take twice. Okay, 1, 2, 3. Okay, 1 second. Let me paste it. Okay. And then another one. 1, 2, 3, smile. Okay, let's see, should be, give me 5 seconds here. Okay, sorry, the second one is not good. 1 second, doesn't work. Let me take the second one again. Sorry, because the bar, okay, 1 second. Not ready. Okay, 1, 2, 3 again, smile. Okay, let me see. I make sure the banner is not blocking anyone's faces. Okay, got it, I got everyone's faces here.
Did you get everybody?
Yes, beside the one turn off the video.
Right. Okay, great.
Mm-hmm.
All righty. So Maria, we will be back in touch with you. We will send you some emails if anybody has any questions, but your story was incredibly powerful. And I'm so glad that you are an elected official. We absolutely need more people like you. We definitely need to be represented. So thank you so much for many, many things, but thank you for being here today.
Thank you for inviting me.
Also.
Thank you so much for inviting me. Thank you, Lisa. Thank you, Susan. So thank you, Rainey, for being here. Talk to you guys later, okay?
Okay, we're going to...
Can I say one thing?
Sure.
Actually, Gary, I just want Light and Salt Association to know, we have been supporting Gary in the cancer care.
I assumed, yeah, definitely.
Okay.
Absolutely. Thank you, Lisa.
Okay. All right, so we have a break. We're going to cut it down to 5 minutes because we've lost some time here. So go ahead and take a quick break, and then we're going to be back for our first community highlight, which is the Communities Foundation of Texas. And you guys are going to want to hear this one because they actually give out funds. So take a quick break and we'll be back with you. Thank you. So if people can hear me, I'm going to ask you to come back early so that we've lost 10 minutes. So I'm going to try to catch up time here, but I don't want to take any time away from our community presentation. So hopefully folks will be joining us here quick. Dimple, you're ready with your slides? Okay, good. All right, where's Virgin?
Discrepancies in health data just earlier this year, and it was a repeated conversation.
Lisa, take it away.
Okay, so I am going to share my screen. And I hope everyone can see this. So my name is Liza Laguana-Merrill. I am originally from the island of Guam. I moved to Arizona over 40 years ago. My mother was from the Philippines, and my dad is from the island of Guam. I identify as an Asian Pacific Islander. And what I would like to speak to you today is a community advocate's perspective. So the learning objectives is personal experience, collaboration, and sharing. I have a really simple PowerPoint. So life happens. As you know, when I was a young kid, I grew up and I was thinking, okay, I'm going to find a job. I'm going to get my education, find a job, a partner in life, and then hopefully we'll raise our family, in a successful way. Well, sometimes things don't happen like that. In 2001, prior to 2001, a very dear friend of mine was diagnosed with liver cancer. So they were very close to me and I was very close to them, so I helped them along the way. 5 years later, his son was diagnosed with colon cancer. And I learned so much from my friend, Anthony, because he was a young guy. He was in his 30s and he was diagnosed with stage 4 colon cancer. And it's funny how, well, it's not really funny, but it's ironic how when people are diagnosed with cancer, family and friends seem to disappear. And so I would visit him at least once a week to see how he's doing. And along the way, I learned a lot, not knowing that I would need that information later on. They gave him 6 months. He lived 3 years. Along the way, he told me, it's really important about nutrition. Lisa, it's really important you find a doctor you're comfortable with. You have to be, he didn't use the word advocate, but you have to speak up for your treatment. You have to question the doctors. Just because they're an MD does not mean they know everything. At the same time, it doesn't mean they know you. So I took that to heart. Right before his birthday, my father and my mother were in town. We gave him a surprise birthday party. It was like an advance. He only had about a couple months to live. And I felt that, why are we going to wait for someone to pass to celebrate their life? Let's celebrate their life while they're here. So we had a birthday party for him. My mom and dad cooked. My dad took pictures. He was very angry at me, but at the same time, he was happy. The friends that seemed to have deserted him actually came because they, I think a lot of times people are afraid. They don't understand, when a person is terminally ill, so they shy away from it. But it gave everybody an opportunity to tell him in his face how grateful they were about him. They were grateful to know him. And I think when he left this life, 2 months later, he was satisfied and knew that he was loved. But the surprising part is a year later, I was notified, or I found out my mom had stomach cancer. And it was terminal. So I'm sorry, every time it happened so long ago, but it still hurts my heart. Anyways, she was on Guam. I flew out to Guam, and everything I learned from taking care of my friend, I utilized it. I took a notebook. I did research. I understood. I found out her diagnosis and it was stomach cancer, and I researched everything I could do. So when you think about what can you do when someone is ill, or as a community advocate, you research, you educate yourself, you understand what's going on. Needless to say, my mom survived 30 days. She was diagnosed on Easter, and she died on my husband's birthday, and we buried her on Mother's Day. So that was a very crazy year. Anyways, from there, I had a sudden jolt of what am I going to do with myself? Well, my mom was a very smart lady. She took care of us. She took care of her health. But at the same time, she wasn't an advocate for her health as well. And that's when I started to learn more about cancer. My aunt started to introduce me to, information about breast cancer in the Chamorro community. Our Chamorro community, we don't talk about illness. We don't talk about things that are very personal. And that's why a lot of the women in our Pacific Island community don't realize that breast cancer is no longer a death sentence, but you have to find it early. So anyways, I started as an advocate. That happened with my mother. And I was determined that any woman moving forward, anybody who I know in my community, I need to help them. I need to educate them. But before I can educate them, I have to learn myself. So my personal experience, what I could have done was just say, oh, woe is me, my poor mom, that's what happens. But it motivated me. It motivated me to learn more. It made me realize also that we are marginalized. That, like Susan had said several years ago, she was told so many times, oh, Asian women don't get cancer. Well, the same is for Pacific Islanders, because we don't have good record keeping on Guam, that they don't realize the prevalence of, cancers in our culture and in our ethnic group. So what I learned is that I had to educate myself, research things that I didn't understand. And I was so lucky that I was exposed and I was introduced to Susan, to Pergin. Another life thing happened, life change happened in 2010 when they had a recession. My husband and I were builders. We were well off. We lost everything. We were almost homeless. And actually we were homeless. With the kindness of a friend, he allowed us to live in their house. And then at the same time, I was hired by Asian Pacific Community in Action, and I started social work. I had no idea. I was more of an entrepreneur. My husband had his own business that we built up for over 30 years. We lived in a home. We built homes we lived in them, and then we would sell them. Well, when the recession happened, we lost everything. In 90 days, we lost $3 million. We lost our home. We lost our savings, a lot of our family savings. And so we started from scratch. Well, I was hired from Asian Pacific. I was hired to work at Asian Pacific Community in Action on a breast cancer project. And then it dawned on me that, maybe all those things that we did, the business that we had, was really not my life purpose. And my life purpose is to learn about what really matters and the health of my community. So with Asian Pacific in Action, I learned a lot of things. I learned about collaboration. I learned from other people who are younger than me about being strategic, about listening, looking at the political, perspectives of different things going on. At the same time, knowing that because we're people of color, we are from a marginalized community, that people don't understand the cultural perspective as well. And it's not just when I speak about culture, I'm not talking about just ethnicity. I'm also talking about gender identification. I'm also talking about, religious. So a lot of times when we go to doctors, we go to medical organizations or hospitals, it's always the same. They put us in a box, not realizing, like the previous speaker, she had mentioned language. We didn't have access to medical interpretation. Luckily, my family, they spoke English. My mom learned English over the years. But working with Asian Pacific community, I realized that medical interpretation was so important, especially in Arizona, because we have a huge population of refugees coming in each and every year. So you learn to collaborate. And a lot of times you collaborate with people you may not even like, but it's important, it's more important that the collaboration happens. So as a community advocate, I learned over the years that it was my life experience that motivated me. And it was up to me to seek out the knowledge about different challenges that our communities experience. And at the same time, funding. And you know that funding is really important. A lot of these organizations are nonprofits, so you're looking at grants, you're looking at different ways of funding your organization to continue the work that you do. All these are intertwined. We can't do it alone. So my last slide shows as a community advocate, I had to get out of my shell. And a lot of times my husband says, you always tell everybody our stories. But the reason I say the stories is because sometimes there's people out there that are living the same kind of life, but don't know where to go. By speaking with others, you help and you share information and you share resources. It's really important to work together. That's why I have that circle, because you can't do it alone. And a lot of times, at the end of the day, it's the government, it's policy. You know, not only are we frontline workers, not only are we taking care of our community, but we also have to change the systematic challenges that occurred in the policy that our government makes. So that's why I have these 3 pictures here. And I know it might be a lot as a community advocate. It took me a while, but the main thing I would like to leave with everyone is be willing to be open, be willing to learn, you know, be willing to seek out the knowledge. Don't be afraid to stand up and speak out. And with our Asian American, brothers and sisters and the Pacific Islanders, we're known to keep quiet. And we have to learn to not keep quiet anymore, because it is our people of color and our marginalized communities that are suffering the most, and we need to make sure we represent them and we stand up for them. Thank you. So the next one, I know, because I have short, so this is what I do when I am on my personal time. Now this is my real job.
So I asked Lisa to make this presentation because of her real job and because it's so important right now. So she's going to do a presentation for everyone.
So I hope you guys can see this. So I work as a partnership specialist.
So your thank you screen from the last
okay.
PowerPoint.
Let's see. Let me see. Stop sharing, and then let me share again. Okay, here we go. Okay, now. Okay. So the other thing. So can you guys see that? Okay. So my real job is I am a partnership specialist for the U.S. Census Bureau, and I live in the state of Arizona. Today it's really cool. It's only 108. So we're experiencing some balmy weather. Let's see if I could hold on a second. There we go. Okay.
I'm sorry, Lisa, but you guys in Arizona are crazy.
So before I continue the important part, I wanted to just do some Census 101. Why do we do the census? Well, it's mandated by Article 1, Section 2 of the U.S. Constitution. Starting in 1790, the first census was held. Then it's held every 10 years after that. And what it is the actual enumeration of all the people living in the United States. In 2010, after the results, these are the different states that gained representation in the House of Representatives. So right now we have 435 representatives. And when you hear about apportionment, what that means is a state can gain or lose a representative based on their population. So in 2010, Arizona actually gained 1 representative, and then these are the other states that lost. You're hearing a lot about that in the news right now. In addition to that, it's 675 billion federal dollars every year. So $675 billion is allocated to every one of the states based on their population, and including 5 of the US territories as well. So if you think about 675 billion, that's for 10 years. And what it's used is, they use that money, federal money, for transportation. HUD uses it for housing, building community. One of the things I really want to emphasize, because a lot of you are trusted voices in your community, the Census Bureau, all the information that you provide during the decennial, during the census decennial, and also on surveys, it's protected under Title 13 of the US Code. What that means is, as a census employee, even if I am released or retire or laid off, for the rest of my life, I can never ever identify information that I have had access to. If I do, I can go to prison for 5 years and fine $250,000. So the U.S. Census Bureau will never ever release information that can personally identify you. So we would never say, this is where Susan Shinagawa lives with her family of pets, her furry family, at this, and there's so many, people living there. We would never release that. At the end, we are required in December to give the number of people living in the United States administration, but it can only be in statistical format. After 72 years, then it's released. So if you ever see Ancestry.com, that's how they get the information about families, is the census will release the information after 72 years. Now, if you want to learn about your own family, you can do that, but there are different kinds of security you have to go through. But in regards to the decennial, we will never release your information, regardless of when even the office is that regardless of whether we have a subpoena, executive order, nothing will make, nothing can make us or will force us to release your information.
I want to state here, just interject, that includes if you are documented or undocumented.
Correct.
That we want to count those people, but that information cannot be released.
Yes, correct.
To anyone or any other agency.
Mm-hmm. So sometimes if we can get a household, we'll get administrative records. Administrative records are IRS records, assessor's records. And even though we may ask the IRS for information, they cannot, that communication doesn't work both ways. They're required to give us information, but if they are to ask us information, we would never release it to the IRS, to immigration, to enforcement. So we're not enforcement, we're not immigration, and we're not legislative. We are just data collectors. We collect data. This year, you can respond online, by phone, or paper questionnaire. Can I see a show of hands how many people have already responded to their census? All right, great. So this is the website. So if you go to 2020census.gov, it will take you here, and you will go directly to to where you can start responding. If you go on the internet, there's actually 13 languages, including English. 12 are non-English, which is Korean, Japanese, Arabic, they're Vietnamese, Tagalog. So you'll see the different languages there. If you call in, there's also an interpretation line. Now, this is important. So we have, let me get this on the side. Okay, so right as of, I think this was in August, 63.1% have self-responded nationally. Arizona, we have 59.5, Hawaii is 59.4, and Texas is 58.0. So what that means is that 59 of the estimated population has self-responded to the census based on either telephone, internet, or questionnaire. The #1 response so far, self-response, was actually through internet. You'll notice Puerto Rico, Alaska is a little bit tanner. In Puerto Rico, they do update leave. And then what that means is that they don't have the ability, you know, people actually go to their houses, and because of the hurricanes, will actually interview the individual households. Alaska, because of its remoteness and the weather, we also did update enumerate, which means before it got really, really cold, or before it gets really, really cold, enumerators will go to the state and actually talk to people and interview them right there, and then also pin their location onto a map, so that, because a lot of times they won't have city style addresses, so that the Census Bureau will be able to locate them. Now, because of COVID-19, this has been a very historical year. We had to do some operational adjustments. The first thing is self-response phase. So the self-response phase means it's the way that people can, you know, respond. Originally, it started March 12th to July 31st. They revised it to March 12th to October 31st, but just last week, it was changed to September 30th, which means they cut the time 30 days. Group quarters, now, so in addition to counting different households, we also do group quarters. And when you talk about group quarters, it's the dormitories, assisted living places, prisons, they all get counted. Everybody gets counted there. And a person, even though they're from out of state and they're living in a prison in Arizona, they will be part of Arizona's population. So we gave these areas, or these locations, a choice to either e-respond or do a paper enumeration. What that means is that they can go online, fill it out themselves for each individual person that's in the location, or we will send somebody out. The time was April 2nd to June 5th. It's changed from April 2nd to September 3rd. Now, service-based enumeration. So as you know, because of COVID, there may be a lot of people who are experiencing homelessness. This is how we count our population that's experiencing homelessness. Normally, it's between March 30th to April 3rd. A lot of times they don't give the main dates, because we found that sometimes cities will take their homeless population and move them somewhere else. So what we do is we work with service-based groups such as shelters, soup kitchens, and they help us locate areas of where populations who are experiencing homelessness stay. And it could be in underneath bridges and alleyways, sometimes in their vehicles. This operation is going to happen September 22nd to September 24th. Those are we don't have exact days, but what happens on these days is that a team of enumerators will go out in the middle of the night and count everyone that they find in the locations that they're most commonly reside, people who are experiencing homelessness as well. I know there's some questions. I'll get to the questions in a second. So now update leave stateside. So originally it was March 15th to April 17th. We had to phase it in between May 4th and June 12th, and actually through July. What update leave is when an enumerator will drop a packet off at a residence, and it's most likely because they have a rural address, not a stateside address. That means that it's the red brick house on the side, after the cactus, and then you go down 2 miles, it's the Uncle Joe's truck, and then that's the house. So when they have addresses like that, that is what happens. We use update leave, and a lot of times it's in our tribal nations, because a lot of our tribal nations, they're where they live, it's remote, and may not even have a regular road, but dirt roads. So we have questionnaires dropped off at 5 million addresses. At the same time, they will pin, their location. They're given they're given a paper questionnaire with a unique ID, and that ID actually identifies that household at that area pinned on a map. Non-response follow-up is the big operation that's happening now. Originally, it was from May 13th to July 31st. Now it's August 6th to September 30th. that is when census workers will come to your door. If you have not responded, they will come to your door and knock on your door to try to interview you. They will actually go up to, come back to the household up to 6 times. It might be shortened because our timeline has been shortened, but don't fear that if a numerator comes to your house and they will leave a notice of visit, with your census ID on there. If they did leave that, go online and respond. They will not come back for the next 48 hours. And as soon as you respond online, they will notate it right away. And there's we'll say 80% possibility that it will drop off the case list and the numerator won't come back. So please, really, really encourage people to self-respond right now before we come knocking on your door. What we're also doing is, especially in low response areas, we have mobile questionnaire assistance. So what we're going to be doing is we're going to be tabling. We can't gather yet in Arizona. So what we've been doing is working with organizations and at food distribution areas, backpack distributions, in front of grocery stores, libraries. We will set up a table. We practice social distancing. We wear a mask, we wear gloves, and we offer assistance to anyone who needs it to help respond on the to the census on their own device or on a device that's given to us by the Census Bureau. What's going to happen also is the Census Bureau has been really, really doing a push campaign now. Not only have we been paying for more advertising, if you notice on Facebook, Instagram, everywhere on the news, television, we've been doing a lot of advertising asking people to respond. In addition to that, we'll be sending out also reminder emails. And how we get your email addresses is that most likely your address was selected to participate in a survey before, and we keep a database. Of course, we would never sell that information to a third party. We're also doing follow-up phone calls. I did my survey it's about 3 months ago when we first opened in March, and about 2 weeks later, someone called me up. At first, I thought it was a scam. They left a message, and then all they said is, Lisa, I called back. They gave me the information, a reference number, and they said, call back. I called them back, and they actually just said, you filled out your census questionnaire. I just want to verify. We did it less than 5 minutes. He verified the people I put in there, where I lived, and asked if I forgot anybody, and I said no. To notice, so if you do get a phone call and a person asks for your financial information, like your bank account, credit card, social security number, it's a scam. We would never ask for any of that information. Our census workers will have a badge, will have a backpack, a portable device, a smart device. They'll be wearing a mask and gloves. Even though some states may not mandate a mask, the Census Bureau mandates all partnership specialists, all employees of the Census Bureau will wear masks. So what is your circle of influence? So how can you help? Oops, sorry, I forgot to change that, St. Patrick's. Anyways, how you can help is continue to ask your friends, your families to respond if they haven't done so. Make sure they respond and tell them the importance of doing the Census Bureau. Support non-response follow-up. That means if they're in your community, let everyone know that it's safe and it's secure. And if you want to help more, contact a partnership specialist in your area, in your state, and they will help, and help them identify people, who are experiencing homelessness, hard to count populations, invite them to some of your distribution events so that we can continue to pass out information. This is something, stop the knock. So, stop the knock, respond to your, self-respond to the census. This is a link where you, as a partner, you can get more outreach information. And the census is happening now, so I don't have to. So anyways, that's it. Sorry, I was going really quick. But the main thing I want to say before I'm cut off by Miss Susan, it's really important that our communities participate in the census, because if we don't participate, if we don't have the numbers, then we don't exist. And many of you who work with grants, the first thing they ask is for the data. Why do you need this money for? What is the population? How many people live in that area? And that information comes from the Census Bureau. So if your community is reluctant, is scared, you know, to participate, please encourage them. It has nothing to do with status, immigration status. It has nothing to do with, you know, religion, anything like that. We want to have the numbers. We need to have the numbers. So, you know, our people of color communities, our refugee communities, we are undercounted so many times, and because we're afraid, because there's information out there that's scaring us. But as a partnership specialist, I swear to you that nothing will be, you know, none of your information is shared, but it's very important that we get counted. Sorry, so anyways.
Thank you, Lisa. I want to say one thing else too. So all the data that I present about, you know, cancer statistics and everything, those things are based off of census data. So like rates are based off of, you know, 100,000 population or 1 million population. And so it's very important that those numbers are correct also. Otherwise, cancer data and other data that uses census data will be wrong. So it's very important. And the big thing is representation and money that goes to communities. So it's very important. So either for her advocacy presentation or her census presentation, who has questions for Lisa? I'm sure you have lots of them.
And just one last thing, the absolute last time for you to respond is September 30th. We do not postmark. We don't go by postmarks on the census forms. So if you want to fill it out completely, if you're like, oh my gosh, I forgot it's September 30th, go online. You know, go online. That's the quickest way to get counted. If you don't have your census ID, your census, if you lost your census ID or threw it out because sometimes it looks like junk mail, you don't need your identification number. You use your address. Just use your address. Okay? So it's really, really important. I can't stress it enough because our time has shortened by 30 days, and 30 days is a lot for our communities. So right now we're working, I'm going out, trying to connect with as many people as I can, encourage them, going online, speaking to you today, but please get the word out. And if you need help with anything or you need information after this conference, my email, Susan can share my email. Contact me anytime. I work 24/7. Okay.
Yeah.
I'll give you my my personal email because we roll off in September, on September 26th. So if you need information on September 28th, just email me because I will still be advocating for our communities to make sure that they actually respond. So thank you. Any questions?
If you have a question, just unmute yourself and speak because I can't see everybody at one time.
I'm sorry if I talk really fast.
I have a question for you. You're in Arizona. Why is your title in the Denver?
Okay, Denver, Dallas region. So the Census Bureau actually cut down their offices. So our region, Denver, Dallas region includes 12 states, which Texas is one of them. California has the California, LA region. So since I even though I live in Arizona, Arizona is part of the Denver, Dallas region when it comes to the Census Bureau.
Wow.
That's what that means. So, well, thank you, everybody. Okay, so I didn't see, I'm going to put everybody on the spot. I'm going to do the galley view. How many of you filled out your census form? Please raise your hand or thumbs up. Yay.
Online. It was easy.
Yes. And if you haven't, it's okay. You still got time, but please do that. Please.
Please get that information.
Yes.
In. Yeah.
Well, thank you, everyone.
Thank you, Lisa. Thank you for both of your presentations. Really appreciate it.